So I was born in North America and lived the first decade or so of my life in North America, after which our family moved lock, stock and barrel to Karachi. And this was in the 1970s, 1977 to be exact, which was, as probably all you remember, a tumultuous time in Pakistan's history. And after that, we lived the formative years of my life in Karachi. A lot of my memories that I have are from Karachi, from school at Habib Public School, going to college at DJ, eventually ending up at AKU with a short detour through Army Medical College. I have incredibly fond memories of my 5 years at AKU. As opposed to North America, or in particular the United States, where students enter medical school after 4 years of undergraduate education. Medical school in Pakistan, in particular, is really the place where you gain maturity, you gain knowledge in addition to training and all that. And so it's a formative time in your life, and I'm really grateful to having spent that at AKU. Also because I met my wife here, who was my medical school classmate and who's an infectious disease doctor now. After graduating from AKU, we both moved to the United States for more training. We were very fortunate to have managed to get into training programs, and then I always wanted to be a pediatric surgeon, having been incredibly influenced by pediatric surgery here with Quaid-e-Azam, who was the first chair of surgery at AKU. And I was incredibly fortunate that I managed to match into pediatric surgery and then become a pediatric surgeon. I then spent 19 to 20 years of my academic career as a faculty member in the United States, first in Mississippi for 3 years and then for 16 years at the University of Florida, where I spent the last 7 as a professor and division chief of pediatric surgery at the University of Florida. So the offer to be the chair of surgery at AKU came at kind of a crossroads in our lives, both myself and my wife. Having been a division chief there for 7 years, I had begun thinking as to, what's the next step? I'd also become very comfortable. And sometimes to grow, you really have to move well beyond your comfort zone. And I started thinking, I always wanted to return to Pakistan and in some naive kind of way, serve the country in some way, shape or form. And finally, after 30 years of having lived in North America, that intangible, naive vision had incredible focus, where one could return to Pakistan, have the role of the chair of surgery at my alma mater, which is a massive honor. It was inheriting a department of surgery which was already very strong, had 10 different sections, had a tremendous amount of postgraduate training programs and effort in that, and a really solid base, a great name for patients to come and seek care for in Pakistan. And the opportunity to take that and move it to the next level and its next natural progression was just too difficult to ignore. So that's what dragged me here. And so the goal really is to hopefully train the next generation of pediatric surgeons, if I look at it from a very personal perspective, but also to improve the training programs that are already very, very good and are already accredited through the ACGME International, and to make them even better, so that when graduates from Pakistan think of where they should seek their training in surgery, they should first think of AKU.